It is a pleasure to be with all of you during 73rd conference of Cardiological Society of India being held at Hyderabad. Weather is good, but things are gloomy. I am Dr. Rakesh Varma. I am professor of cardiology. I served as head of the department of cardiology for 25 long years at Safdarjung Hospital, and presently I hold the administrative post of Additional Director General Health Services, Ministry of Health, Government of India, New Delhi. Friends, as you all know, in last 75 years or 80 years, cardiologists, physicians, interventional cardiologists and therapists have brought down the mortality, morbidity and side effects of myocardial infarction and related diseases from whopping 60% to almost 7%. From a data published in Circulation, in 20 years beginning from 1995 to 2015, the cardiac mortality by cardiac problems has reduced from 23.7 to 5.2. What a remarkable benefit! But that is the pre-COVID era phase. Now, COVID-19 has spoiled all those things. The cardiac mortality has gone up by 4 times. The chances of cardiac shock has increased by 2 times. There is a very, very large number. 4 times more death is really disheartening, discouraging and frustrating. The patients of heart attack, acute coronary syndrome are not getting beds. They are not getting physicians to attend to them. They are not getting paramedics to do an ECG. They are not getting echocardiography to do the echo, because everybody is suffering from a phobia which is partially imaginary but partially well founded. We have lost senior doctors, senior physicians, very senior interventional cardiologists, middle level doctors and very junior doctors due to COVID. So, it is very difficult era for all of us. Those patients who have got serious symptoms of heart attack, they are not having guts, strength and confidence to go to a hospital, because our regulations require them to be first tested for COVID by RT-PCR test, which takes 24 hours. Then the doctor is not there to attend to them. The ECG technician is hesitant in touching any new patient, and after diagnosis also they are finding difficult to get a bed. I have served in the world's largest hospital, that is known as Safdarjung Hospital, which is in the government setup. We were forced, constrained and had to allocate a 8-story building with over 6 lakh square foot of the space, which are previously occupying super specialty like neurology, neurosurgery, cardiology, cardiac surgery, urology, nephrology, all respiratory medicine, all facilities had to be shut down to make way for COVID. Now, with the COVID, since we have not studied it much, if there is one patient of COVID in a ward, whole ward is vacated so that other COVID patients could come. Now with Omicron, earlier we had Zeta, Beta and now Omicron looming on the horizon. When it will knock at the gates of India, we do not know, but we are all very scared, all very worried, all very concerned. So we have to keep our facilities still open, waiting for not to be waiting COVID-19 and its new variants. I request all of you, we being physicians, cardiologists, interventional cardiologists and I as a health administrator today, request you all to kindly take care of fellow physicians, senior residents, junior doctors, nurses and paramedics as much as you take care of the patient. Because if you take care, others will also take care. If you survive, you can make others survive. With this, I request you to please don't get scared, be careful about it and treat your patient with full devotion and dedication as you have been treating for last decades of year. With best wishes for a new year 2020, maybe that we forget and forgive and leave COVID-19 infestation behind us and restart treating patients with the same confidence as we have been treating before that. Namaskar. Dhanyavad.